slides. Let's now proceed to today's agenda. In today's Coffee Talk session, my colleagues, National Center on After School and Summer Enrichment, will join me in facilitating conversations with you. We will hear from representatives of Nevada, South Carolina, and Tennessee as they share their mental health initiatives, which align with the Office of Child Care's recent information memorandum titled Strategies and Recommendations for Using the Child Care and Development Fund to Enhance the Mental Health and Well-Being of Children, Families, and Child Care Providers. Going forward, I will refer to this memorandum as the IM. As we progress through our presentation, we will provide a more in-depth overview of the topics listed on the agenda, and we'll explain the driving factors that influence the development of the content. Now let's review today's objectives. So we have 3 objectives for today's Coffee Talk session. The first one is all about learning from lived experiences. Again, we'll hear from representatives from Nevada, South Carolina, and Tennessee as they share their insights on developing and maintaining mental health systems of care. Links to the profiles for Nevada and South Carolina are in the chat. And again, they'll be at the end of the slide deck. Tennessee's profile will be published in the coming weeks. The second objective is all about reflecting and exchanging ideas. We will reflect on the state presentations and focus on exchanging ideas, experiences, and best practices in mental health across different roles. Now, during our August 21st webinar, we polled the audience and found a strong interest in learning more about Strategy 3, as well as effective mental health and direct service engagement practices. One of our breakout rooms will be dedicated to staff providing direct mental health services. Our goal is to be responsive to your expressed needs. And our final objective is about supporting future activities. We will use the information from today's session to support the development of additional activities related to mental health and well-being. From the data that we collect today, we will assess existing technical assistance and resources, as well as identify what's needed. These objectives will guide our discussions and help us make the most of our time together. So let's begin with the opening poll to find out who's joining us today. So please choose from the role that best describes you. Give everyone a minute or two to complete the poll. And when that poll is ready, we will launch the results. I feel like we need a drum roll. All right, it looks like lots of policymakers here. So those that are responsible for making policies related to mental health and well-being. Also some CCDF administrators. And there's a lot, well, not a lot, but a good amount that are in the other category. So if you'd be so kind as to indicate what your role is in the chat, if you fell into the other category, that will be helpful for us. So it would be really nice to know how you might describe your role if you fell into the other category. All right, and so now I'm going to turn it over to Lisa. I've done a lot of talking and we'd like to hear from you. So we're going to do an opening activity.
Thank you, Erica, and thank you for everyone for popping in and answering that poll. Now that we've heard just a little bit about who you are, we'd like to hear about what you've been learning. As Erica mentioned, the feedback from our previous webinar described Strategy 3 that includes learning about mental health topics. So in the chat, please take a moment to share a mental health or well-being professional development opportunity, could be formal or informal, that you recently participated in, and a key takeaway from that. So maybe you attended a training, Maybe you provided a training. And I see also folks are popping in there with their other roles in case one of those roles didn't fit you well. So feel free to pop those in as well. Maybe you recently read a book and there was a mental health related takeaway that you would share with others. Maybe you listened to a podcast on your commute that you might count as informal learning that you have recently gathered and have a takeaway you would share with others. Give just a moment for folks to think about that and see if there's anything you can share with others in this moment that you would describe as a key takeaway from a mental health or well-being learning. Ooh, thank you, Melissa, for popping that in there. Say no when your plate is full. It's a nice phrasing, metaphor, it could have come from anywhere, that helps us kind of attach our mental health and well-being to something we understand well. I really can't eat more than I can fit on my plate in my concrete eating life. And it makes sense to then say, when I have too much on my metaphoric plate, it's okay to say no. Ooh, Robin, thanks for that one for us to think about. When you say yes to others, you are saying no to yourself. Sometimes there's always a balance of giving and taking. And Jenny shares a children's mental health training I attended last week, really teasing apart the difference between empathy and sympathy and how to communicate with concern. Thank you for sharing that. I'm going to give just a few more moments to see if there are any other takeaways folks would share. Well, Melissa, we really highlight the theme of this mental health IM. Access to service is just as important as having resources available. And thank you, Lorna pops in, the power of listening to learn versus listening to respond. That sense of being able to provide to someone else the experience of being seen, heard, and valued for what their experience is. Thanks for sharing that. Laura, thank you for this. This is a lovely takeaway. Recently had a pre-service presentation on the science of hope, reminding us that well-being is more than just the reduction of what is wrong or taking away or fixing what's wrong, but hope is also a combination of beliefs that things can get better. And it's also an active verb. So there's action in it. We have to take action to get to a goal. It really puts that piece of self-efficacy into mental health and well-being. Now they're kind of starting to roll in. The Surgeon General has a workplace wellness statement. There's just a little tidbit we can all connect with, something to look more deeply into. Jennifer notes, I just completed a training around building attachments from birth and the importance of how healthy attachment from a young age impacts a child lifelong in their social emotional development and feeling they have a place in this world. That's right. We know from decades of research about interpersonal neurobiology that well-being begins in infancy with those early relationships. Thanks for sharing that. I think feel free to continue passing in comments. But
can I just, I wanted to just comment on what Jennifer talked about. I actually just attended an informal mental health and well-being session, and it talked just about this notion about these healthy attachment styles. And it's from Shay at Rising Women. And she talks about how your relationships that you have, particularly with your caregivers, how it influences the relationships and the dynamics that you have as an adult. And when you're picking partners, you'll be surprised at how you end up playing out that dynamic that you had with your caregiver. So while we talk about children and infants and toddlers, it's just all connected, and it's just so important because it carries us all the way up through adulthood. So thanks for pointing that out, Jennifer.
That's right. And I'll go ahead and have us advance to our next slide. If you would like to follow along, and again, feel free to keep sharing your lessons learned, but if you'd like to follow along today as we discuss the IM and particularly strategy 3 and its example activities, we have this QR code on the screen so you could capture it quickly, but we'll also drop into the chat. Thank you. A link to the information memorandum itself so that you can access it on your own time. And now I'm going to pass over to Bianca, who will introduce a few state partners who are using the Child Care and Development Fund to promote and invest in mental health and well-being of children, families, and the child care workforce. Thank you.
Thank you, Lisa. All right. As again, hello, everyone. I am Bianca, and we are pleased to move on to our presentations where you will gain insights into the mental health and well-being initiatives of programs from Nevada, South Carolina, and Tennessee. We are really excited to have their expertise and experience enrich our discussion today and offer valuable perspectives. Our first state strategy in action is Nevada. We will now hear from Jennifer Hines, the Early Childhood Community Health Worker Program Manager from the Children's Cabinet. Jennifer?
Awesome. Thank you so much. It's so good to be here today. Yes, this program has been amazing. The connections that we've been able to make so far within the community and just supporting so many children and families has been so rewarding and impactful, and it would not have happened had we not had funding. This program came during COVID, and through COVID relief ARP funds, it got us started. We started out, we're about 2.5 years in now. When we started, we had maybe 30 early childhood provider programs statewide working with us, and now we have well over 250, so it's pretty amazing. This is a statewide program, so we have a team here in Southern Nevada in the Las Vegas area, Clark County, and then we also have a team up in the north, the Reno, Washoe County, as well as reaching a lot of the rural areas. We noticed quite quickly, a year or so in, the need for early childhood community health workers within the rural communities because they just didn't have access to a lot of resources that we would be able to help them with. So our program, what we do is we start off by reaching out to the early childhood providers throughout the state. They're licensed either child care centers, family child care centers, or family friends and neighbors who are getting subsidy throughout our state. So really supporting our low income families to be able to provide a high quality child care experience, and it gives their parents an opportunity to go to work or to go to school. So that's the foundation of how we start. And so we make those initial connections with the providers. We walk through a needs assessment with them, seeing what areas we can support them in around health, wellness, and safety. We then, after the provider has gotten in touch with us and they're like, yes, we definitely want you to participate and help our program, we do the needs assessment. They are assigned a community health worker. We do our best to ensure that that community health worker is someone that comes from the community that they are in, where they're located. Also, if we know that there's a lot of bilingual families, we want to ensure that they're getting a community health worker that will be able to help break down that language barrier, who is bilingual and speaks the same language that they do. We've been very fortunate to have a very diverse and mixed team to be able to support all of our clients. And that's been pretty amazing to be able to see the work that they're doing and the impact that they've made. Once we get the provider on board, we then reach out to them and ask if they have any staff who would be interested in our supports as well. And then of course, families. Our goal is to help the whole program get their needs met and the supports that they need, as well as those families and those staff members who might be struggling with either homelessness, they don't have access to healthcare, transportation issues, food insecurity, needing a social emotional curriculum for their programs, being able to support any children who have special healthcare needs within those programs, as well as helping those families get access to the supports that they need. So we kind of just do a little bit of everything. And we focus on all areas in the early childhood world, which is great. It's not just the providers, but it's also, like I said, the staff and all those families connected, but also the communities where they reside. We offer yearly community resource fairs. So we have many community partners throughout the state of Nevada that join us to be able to bring resources to our communities who don't have access, especially our rural communities. A lot of times they're like, we don't have a lot of like healthy food options where we are, or access transportation wise to get those extra resources that we might find in an urban area. When it comes to diapers or food banks and things like that. So we're able to bring things to them to support them while they're working on goals to kind of reach that self-sufficiency for themselves. So it's been a whirlwind of a few years. The impact, like I said, has been pretty amazing. The providers are very excited. They were like, where have you been? We needed something like this a long time ago. We also provide a lot of additional trainings and things for our staff around diversity, equity, inclusion. It's a foundation for us. We do quarterly trainings around that to ensure that we're able to fully meet the needs and understand the communities and the individuals within them to be able to fully support them. And then we're also members of the National CHW Association, as well as the new Nevada Association for Infant, Toddler, and Early Childhood Mental Health. So we partner as much as we can to get the word out to support them, as well as them working with us. The more that we do that, the more outreach we get to the families, the providers that we are supporting. And it's been amazing to see the growth and the success of these families who start with us, reach their goal, and they're able to maintain it. And these providers to be able to get the help they need to be able to provide a very strong and high quality center for these children as they are starting off their lives and their education, right? It starts from birth. So being able to provide that has been really important. And so we look forward to continuing that work and sharing out as much as we can about our program and helping others to create something if it's something they're interested in, because it makes a difference.
Absolutely. Thank you so much, Jennifer, for sharing. We greatly appreciate your time and your expertise and for sharing. We will now move on to our second state strategy in action, South Carolina. We will hear from Carrie Schnacky, who is the founder and CEO of South Carolina Infant Maternal Health Association, or SCIMHA, and is also the creator of the Be Well Care program. Carrie?
Yeah, thank you. So as Bianca said, I wear two hats. I'm the CEO of South Carolina's Infant Mental Health Association, and that is where in South Carolina, our infant mental health consultation work for early care and education providers, that's where that program sits. And then I also lead Be Well Care Well, which is what I'll be focusing on today. I created Be Well Care Well in 2017, really in response to, at that time, I was leading our state's infant and toddler specialist network. And we were just regularly in our monthly check-ins, the team was reporting, like, I'm there to talk about building relationships during diaper change, but the teachers are in tears because they literally can't feed their own families for the week. These really serious, and it was persistent and common, and it felt crazy to not do something about it, to just keep doing what we were doing. So I got a Kellogg grant, created Be Well Care Well. I was really aiming for something that was comprehensive and really looked at well-being in this kind of holistic way. So we leaned on the 8 dimensions of wellness that are commonly referenced in public health, and also wanted to think about something that would be lasting, not just kind of a one-off training. So Be Well Care Well is a 12-month program in which one of our Be Well Care Well coaches works with a caseload of it's around 10 early care and education programs, and that could be center or family childcare. And again, with that long-term impact in mind, we ask each site that we work with to establish their well-being committee that's made up of the programs director and 2 or 3 staff who are the on-site well-being champions. And that's kind of the very first stages of helping it be embedded in the programs. We also kind of get at that with the orientation. That's the kickoff meeting. And at that, we want every staff to be there. If they have a bus driver, we want the bus driver. If they have a cook, if they have a janitorial staff, whomever, because this is really about a culture change, and everybody needs to be part of that and part of the community that's thinking about well-being, their own well-being and each other's. So we kick it off with that orientation. Everybody All the staff fill out a very simple well-being interest survey, and then the well-being committee and the Be Well, Care Well coach, they meet together, they look at those interest surveys, and then they kind of decide like where are some shared interests, what areas of well-being seem to be elevating for this group. And then the other part of this program that I developed, it was this well-being activities guide, because all the behavior change science tells us that we're really good when we're stressed and overwhelmed. We're really good at getting in our own way of trying to get out of that space. And, you know, we can set very lofty goals that we could never achieve to kind of set ourselves up for failure, or sometimes, you know, just unrealistic about it. So we created this well-being activities guide just as a way for the teams to think about how well-being can be applied to their everyday work life in the early care and education setting. What are some real practical things to do? And they can come up with others that aren't on that guide. It's just a starting place. And then with each of those activities, we align it with one of the 8 dimensions or more of the 8 dimensions of wellness to kind of show that tie-in. Most of the activities kind of sneak in, either indirectly or directly, some element of team building, because again, behavior science tells us that that's where our resilience comes from, is relationships. And the stronger the relationships among the team, the better that they are going to be in supporting each other. And then of course that benefits the children too when the teams are strong. Let's see. So then from there, the well-being coach is really working with the well-being committee and then all the staff to achieve whatever well-being activities they decide they want to do. Sometimes that's just helping them organize, you know, like they want to do maybe a step challenge. So it might be deciding like, how, you know, what are the logistics of documenting that? A lot of times it's going out to the community, and the well-being coach is also part of that community, but they're going around and saying, hey, you know, local gym, you say you offer discounts for teachers, but they have to show a school district ID. Have you ever thought about extending that benefit to childcare providers? You know, they're a really important member of your community. They've done things like they'll negotiate discounted, or some spas have done free chair massages during a staff meeting. Those paint and wine places, we've had some of those donate a free team building night for early care and education teachers. So there's a lot of the community. The coach is really advocating for early care and education professionals in the community in this way, and generally have a really positive response. So we've done that. We have done evaluation, external evaluator at the Medical University of South Carolina, and have shown it's working. I'll drop a recent publication in a journal about show our evaluation results rather than talking about it, because what I find more compelling is the examples. And it's really heartening to hear from the teachers, the staff who are making like real serious life changes. We had a family childcare provider. She had not been to the regular doctor for an annual checkup in 10 years. And this was just like, all she needed was somebody to say, you know, you're really important for you and for all of these people you care about. And she's like, oh yeah. And we've also had directors who started rewriting their job descriptions to elevate their value for well-being, staff well-being, and that is kind of a recruitment tool. And then there's lots of like little small things. One site was like, you know, this is a great idea. We don't have any time for anything else, even if it's good for us. And the coach said, how about if you just do 2-minute hallway check-ins? First thing in the morning, grab a partner, walk down the hall, say, how are you doing? Another coach said that after a training one evening, they were all walking to their cars, and she just said, what a beautiful tree line you have, and the sun is setting, and that is gorgeous. And convinced the teachers that every day when they pulled into the parking lot, before they walked in the building, to just stop and notice like one thing in nature that they found beautiful. And the teachers' reviews of that are glowing. Like, it's such a small thing, but it's so grounding and reminds me to just kind of observe where I'm at. So there's lots of those kind of small but mighty, I think, changes that are really having an impact. And you can see it in our evaluation. It's benefiting the teachers. We have some small scale study of observations using the Climate for Healthy Interactions and Learning Development called CHILD, and have found that in a dose response kind of fashion, the more that teachers participated in well-being activities, the better the outcomes on this CHILD score, which really is looking at the mental health climate, their interactions with children. So those are improving. And we've been able to replicate it in other states. So we have Be Well, Care Well in Arkansas. It's got a coach in New Hampshire, and it really is, it's applicable. It makes a difference. It's just really hard. It's my passion project. I love it so much. So I will stop there for now.
Thank you so much, Carrie. The zeal in your voice is radiating and truly inspiring. So thank you. Our final strategy in action is Tennessee. We will now hear from Gwen Lassier, who is the Director, Child Care Services, Division of Child Care and Community Services with the Tennessee Department of Human Services. Gwen?
Thank you so much. And I feel honored to be part of this group this afternoon. So I'm going to be speaking from the lens of really as the CCDF state administrator and how we're working to provide and deploy these resources for our child care workforce, as well as for children, families in the state. And we have a network of partners, as many states do. We call them our quality partners, and each has an area of subject matter expertise to where they can support creating these and promoting these environments that are safe, healthy, educationally rich, and really promote overall well-being for children. And so we've identified that we need to make certain, as we're deploying these resources, that each area of the partners' expertise, that they're working in partnership with other partners, so that there's warm handoffs if needed for the workforce. You know, if I need specific training in adverse childhood experiences or building strong brains, then all of our partners know which way to refer them. And so in 2017, we really started working and focusing more on overall well-being. And through our partnership with Child Care Resource and Referral, we began offering trainings on adverse childhood experiences, building strong brains, and trauma-informed care. And then in 2019, we wanted to strengthen the area of mental health and well-being for child care providers, as well as for our other partners, and understanding those resources. And so we onboarded the Association of Infant Mental Health in Tennessee to begin deploying mental health and well-being activities, such as attending, enrolling in reflective supervision, also in consultation, participating in IECMH well-being trainings, receiving emergency support services, or, you know, in a number of other supports that are available, such as consultation. And so throughout these partnerships, each year when we convene our partners to work on strategies and where are the gaps, it's identifying the gaps so that we're able to bolster those resources to deploy and meet those needs. And so as we begin each federal fiscal year with our new contracts, we look at ways that we can make improvements. And so part of that, you know, we knew that as we were building more inclusion services, we need to have that understanding of what that means for a child care agency who is providing, you know, an inclusive environment. So what types of resources need to be made available? So it's not only training, it's also those practices that are involved, and, you know, a belonging program, and working in those linguistics in infant and early childhood mental health practice. So it's really every year it's evaluating as we see shifts in what the needs are within those programs and within the workforce. What do we need to deploy to strengthen that? And so our partners work very closely together to make certain we're identifying what those needs are, so that we can deploy more resources to them, so that they are building those programs that are going to promote those successful outcomes for children. So that's kind of my overview in a nutshell. I know that Erica stated that our profile will be launched, and we don't have a catchy name, which I wish we did for our program. It's just really a lot of different initiatives that we've put together to help support building those strong environments.
Well, thank you so much, Gwen. We really appreciate your time and for sharing. So again, thank you actually to all of our presenters and speakers today, Jennifer, Carrie, and Gwen. We really appreciate your time and your valuable insights. We are excited to move on to our next session where we can dive deeper into breakout sessions where we have a little bit more rich conversations. So now that you have had the opportunity to hear from our presenters, we'd like to engage in some reflective dialogue during our breakout sessions, which will not be recorded, by the way. Here's how it will work. We will have 3 breakout rooms based on different roles. Staff providing direct service, that's one room. The second room, leaders of staff providing direct services. And our third room will be state level leaders. Each breakout room will last for approximately 20 minutes, and we will give you a heads up at the midpoint when we'll give you a heads up midpoint, and then also when there's 5 minutes left. During the 10-minute mark, we will share some guiding questions for you to think about as you prepare for the report back discussion. So at this time, we will have the breakout rooms available, and you can go ahead and join your respective breakout room. Once you join, your assigned facilitator will share guiding prompts for the discussion. Please remember to assign someone to be this will kind of help you. For folks who, just again, as a repeat, for folks who are joining us virtually and we're unable to view our breakout sessions, this slide provides an overview for the questions that we discussed and help provide some guidance for our breakout discussion that we are going to have. So, being mindful of time, I do want to acknowledge that we had in our breakout sessions, we were able to go over some of the SOAR prompts, SOAR prompts to report back our discussion, where we were able to identify strengths, opportunities for improvement, aspirations, and results, including challenges and barriers, and then of course, next steps. And so I do want to be mindful of time, so I will ask for folks who would like to share back. Well, I guess I just want to be mindful of time, that these are some of the things that we discussed. Considering that we do have 3 minutes, I am going to move us forward with just talking about technical assistance and resources. So I will turn it back over to Erica.
Yes, thank you so much. And as we just think about upcoming TA and perhaps future just coffee talk sessions, I think it was just wonderful to be able to hear directly from the states. But we also might want to consider extending these to 90 minutes instead of an hour. But that's always a thought. But we listen to your areas of interest, and we will be focusing on strategies 2 and 4 during our subsequent coffee talk sessions. And in addition to the IM and mental health strategies and action TA offerings, immediate technical assistance is always available. So we encourage you to reach out for assistance, and you can scan the QR code or access the TA form online, and we will share the link in the chat. And with just 2 minutes remaining, we just wanted to thank you for joining us today. We really appreciate your commitment to supporting the mental health and well-being of children, families, and the early care and education workforce. And as we think about post-session application, please share in the chat one step you will take this week to create training and professional opportunities that equip childcare staff to promote social and emotional development. And just a few reminders, following this slide, you will have a list of the resource links. Remember to check out the website for the recording and slides, which will be posted in a few weeks. And finally, as you leave the meeting, you will see a pop-up requesting feedback. Your input is important, and it helps us plan future content and events. So please take a moment to provide feedback. So thank you. And again, if you want to put in the chat what immediate steps that you will take, that will be great. And again, many thanks to our presenters today. Thanks again, Carrie, for sharing your contact information. Lots of folks are thinking about replicating the program, so that's fantastic. Thanks again, everyone. Enjoy the rest of your day.